Hello there. Below is the one of most frequently asked question. The question is, my dog's back leg is swollen, and if I try to touch it and check the foot, he tries to bite me. There is a wound on his foot that is bleeding a little. I think he was bitten by a snake. We have a lot of snakes here, rattlesnakes, copperheads, and water moccasins. I do not have a vet available, and even if I did, I would not have enough money to take him in to be treated. Is there anything I can do at home to make him feel more comfortable? I live in an area with one of the highest numbers of venomous snakes in the world, and I also have 4 dogs. I worry about my puppies when they are swimming in the canals, but I do not worry about the adults much. I have found fer-de-lance sleeping against the warmth of the dogs at night, and just last week I saw a coral snake crossing the driveway where my dogs normally play. I do lose pets at times, but usually only ducks and chickens are killed by snakes, and these are generally constrictors that are unable to hurt a large dog. Okay, since I'm a vet, if one of my dogs came home with swelling and a wound secondary to a snake bite, I would treat him with pain meds, an anti-inflammatory, and antibiotics for a secondary infection. This is not possible for most dog owners, and if you do not take your dog to a vet, his chances of surviving a venomous bite may be much worse. Symptoms of a snake bite: wound, possibly 2 puncture marks that may bleed. Swelling of the tissues in the area of the bite, extreme. Swelling may make the wound hard to see. Lethargy and/or weakness. Muscle tremors, shaking or wobbliness, ataxia. Dilated pupils, vomiting, paralysis. Do not try to extract venom. Do not try to drain the snake bite. By the time you find the wound, the venom has entered the dog's bloodstream. It is too late to attempt extracting it. Things you can do at home include soaking the wound with Epsom salt and giving over-the-counter medications as follows. Make a compress by soaking a cloth in about a gallon of warm water with a ½ cup of Epsom salt dissolved in it. Press the compress gently against the wound if your dog will allow it. Re-soak the compress every few minutes and keep applying it to the wound for about 20 minutes total. If your dog will not allow you to touch the wound, try filling a basin or tub with warm water and about a cup of Epsom salt. Then place your dog, or just the wounded leg, in the water for 15 to 20 minutes. Knowing what we do about pain from snake bites in humans, a dog with a snake bite will be in severe pain. You may see your dog attempting to chew the affected limb, or he may simply lie still and whine. Both of these indicate extreme discomfort. Unfortunately, there are not a lot of good over-the-counter pain medications for dogs, and while aspirin is the most likely to ease the pain, it is a blood thinner. If the dog has internal organ bleeding, so be aware that this might make things worse. If you cannot take your dog to a vet, though, my advice is to give aspirin to reduce the severe pain. Aspirin. Like all NSAIDs, it does have side effects, but may be the only thing you have at home to help a snake-bit dog. It is dosed at 5 to 10 milliliters per pound, but even the buffered aspirins cause gastric erosions and hemorrhages. Naproxen. Though this NSAID can theoretically be used in dogs, it may cause vomiting, diarrhea, and bleeding. Since it is toxic at even moderate levels, prescription NSAIDs and aspirin are much safer alternatives. Acetaminophen. Tylenol is toxic to dogs, but has been used at low doses in some cases. It can cause liver and kidney damage, and even dogs that have recovered from a toxic episode can suffer from liver failure a week later. This is not a good alternative for a dog in pain. There are other non-prescription options that may be helpful in cases of pain, but they are only effective for long-term use and are not going to help a dog that has been bitten by a snake. Fish oil. This is a natural anti-inflammatory, but it is only helpful in some pain cases. It has been proven to be useful in arthritis, but even then, only in the owner-perceived quality of life. Turmeric. This spice may be useful in treating arthritis in dogs, but has not been shown to be useful in other types of pain. There are anecdotal reports that it helps. Green-lipped mussels. This supplement may be useful for arthritic pain after several weeks of use but will not act immediately like an NSAID and is not useful for all types of pain. NSAIDs and alternative pain medications may not be enough to help your dog. You have already said that you cannot take your dog to a vet, so this may not be an alternative. If you live in an area with many venomous snakes, your dogs will always be vulnerable to encounters that result in bites. It is good to have a front line of defense in the form of guinea fowl, turkeys, or even chickens. A flock of guinea fowl will surround a snake and peck at one end, and as soon as the snake turns to defend itself, the birds will attack and often chase the snake away. Sometimes, a free-range flock will help keep snakes from entering your property at all. This video is not meant to substitute for diagnosis, prognosis, treatment, prescription, or formal and individualized advice from your veterinarian. Animals exhibiting signs and symptoms of distress should be seen by a veterinarian immediately. Thank you for watching the video, and please subscribe for more content like this. Comment, like, and share the video.